The body can do some strange things at the end of life, which can scare a lot of people. So let me explain why it's happening and what we can do about it. So we all have sphincters in our body that keep fluids down. So basically in our stomach, there are a lot of fluids that are help breaking down food. Those things are still being produced while someone's dying. It does slow down a bit, but depending on someone's disease, what they're dying from, sometimes it's produced more. And stomach bile can be green, it can be yellow, sometimes black. Sometimes all of those things can be mixed with a little bit of blood, so it can look bloody. If you're curious about what a sphincter is, picture like the end of a balloon. It's something that keeps things closed so they stay where they're supposed to be. So your stomach has a sphincter, like a thing that looks like a little balloon that's keeping your stomach fluid in your stomach. But at the end of life, it can start releasing a little bit, opening up so it can regurgitate back up. And that is exactly why people at the end of life, when they actually take their last breath and die, some people will have a bowel movement because that's also a sphincter in your rectum. So that will release and your bowel movement will come out. Another thing people might see coming from someone's mouth or nose is foamy saliva. This can be very alarming because of course they don't know why it's there, where it's coming from. Sometimes, every once in a while, it could technically be coming from like the back of the throat. It could just be terminal secretions. A lot of it could be coming from the lungs every once in a while, depending on the diagnosis and if they're fluid overloaded. But many times it's coming from the stomach. And again, it's just that fluid from your digestive system that is coming up because that sphincter is not keeping it down anymore. Should you do anything about it, or what do we do about it? The answer is, it depends. It always depends, right? I feel bad that I never can give you guys black and white answers. So if it's really bothering your loved one or it's a lot of fluid, of course, always sit their head of bed up. So if they're laying down and this is happening, you want to sit them up quickly. So I would sit them up almost to a 90-degree angle. This will help gravity work and the fluid will just come out of their mouth. A lot of times families will have those sponges that were given to them by the hospice company. You can do good oral care and kind of clean their mouth out. If it's hard to sit them up or you don't have enough time, you can always just turn them over to their side and that fluid will start coming out of their mouth. It's usually not a lot. Every once in a while it can be. People will say like, my loved one projectile vomited fluid. That does happen sometimes. It just depends on the disease. Again, same thing. It can be alarming, but you do the same thing. You sit them up, you try to clean them up best you can, and of course, always call your hospice company if you need help. So why is it sometimes like projectile and why is it sometimes just a little bit? We don't always have answers for everything. And I think what happens is when someone is scared, when the person who's caring for their loved one is scared and it's their loved one and they just have a lot of fear and want to make sure they're doing the right thing, they want answers for every little reason why this is happening, why that is happening. And unfortunately, in this end of life journey, we don't always have exact answers. That's why I like to make videos that are kind of generally speaking, so you just know that this could happen. And your main goal, if it does, is to continue to keep your loved one clean, safe, and comfortable. So the other strange things you can see at the end of life. This is not a solid list. This is my solid list, but you may be listening to this and thinking, but what about this thing my loved one did? What about that thing? I'm putting all of those things in this list. The ones I can think of are teeth grinding, growling, screaming or like a yell, one final yell, making a face that looks like they're yelling, but nothing comes out. So like a silent scream. Now, again, not everyone will do this, but does it happen? Yes. And I get asked about it a lot. So why are people doing this? Try to not picture this person as your loved one that you know. It's a body. Picture them biologically as the body, which the body is shutting down. And when the body is shutting down, it's doing a bunch of strange things, kind of working to do it. Just like if a woman was in labor, her body is doing a lot of strange things to get that baby born. I feel like a lot of that is how death is as well. The body is doing a lot of things it's not used to doing to help it die. And because of that, you're going to see a lot of strange things we're not used to seeing, like growling, teeth grinding, maybe a final yell or a final gasp. At the end of the day, if you are concerned, like, are they okay? Always ask your hospice company. The hospice nurse is so used to seeing this that they can kind of tell, oh, this is the normal thing that happens a lot when someone's body is just shutting down and they're kind of working their way to death. Or if it's like consistently happening or they're showing other signs of pain, it could be because of pain. It could be because of agitation. They may need to be changed. There are things that could be causing them to do these strange things. And that's not really your job to figure out. All you have to do is call your hospice company and say, hey, they're doing this weird thing with their mouth. Can you come over and make sure that they're okay? And then the nurse will be able to tell you, because they see this kind of day in and day out. Death can be messy, like I've been saying. So here's some ideas of supplies you can keep on hand to help you in those situations. I've already mentioned one, that's the sponges. Most hospice companies will provide you with a little sponge on a stick, and you can use those for oral care. So whether your loved one is having fluid come out of their mouth or not, you should be using those sponges to do good oral care, to keep their gums moist, their tongue moist, their lips moist. But also you can use those sponges to clean out their mouth if they are experiencing some fluid. The second thing is bed pads, or chucks, as I like to call them. Another thing a hospice company can provide you with, they're basically disposable pads. I would have them at least 2 underneath your patient just to keep your sheets clean, and then just to have handy if you ever need to clean anything up. Third, I would keep black or dark colored towels around. Just in the rare incidents your loved one does have a lot of blood or a lot of black bile. Cleaning it up with white towels can feel very distressing, so having a lot of dark towels around will help with that. If you think I forgot something or you have a question, please comment below. Don't forget to check out my book, Nothing to Fear. I have a ton of references in there. And follow me for more death and dying information.